professor, physician, epidemiologist. I am Dr. Sri Banerjee. We're used to having water come out of a tap. However, most of the world does not or cannot experience that due to the lack of clean water and sanitation. Hi, I'm Dr. Sri Banerjee, core faculty for College of Health Sciences and Public Policy at Walden University. And in this video, I'm going to be going over some of the nuances of understanding about drinking water. So I think for starters, it's important to know that 2 billion people live in water-stressed countries. This is expected to rise even more in some regions due to climate change. Of course, population growth is part of it as well. So globally, at least 2 billion people use a drinking water contaminated with feces. Think about that, 2 billion people. Microbial contamination of drinking water as a result of contamination with feces poses the greatest risk to drinking water safety. And a lot of times sewage dumpage or some of the trash gets dumped into some of the rivers. And I'm talking about a river that I've been in, which is the Ganges River in India, even though most individuals believe this to be a sacred river. However, the contamination makes that bathing a lot more difficult. While the most important chemical risks in drinking water is arsenic, due to fertilizers and other types of contaminants from pharmaceuticals, pesticides, PFA, PFASs, and microplastics generate public concern. So drinking water is contaminated not only with microbial feces, but also it's contaminated with a lot of different types of chemicals, such as PFASs and microplastics. Safe and sufficient water facilitates hygiene, and this is a key measure to prevent not only diarrheal diseases, but also, believe it or not, respiratory infections. There's also some neglected tropical diseases, and I've done research on some of these diseases and how they were neglected due to a lot of the mergers that took place in the early 2000s. I studied this in the Centers for Disease Control. I'm going through archives and looking at where there was a change in merger that took place that disrupted research and neglected tropical diseases. So microbiologically contaminated drinking water can transmit diseases such as diarrhea, cholera, dysentery, typhoid, and polio, and is estimated to cause 485,000 diarrheal cases each year. And deaths, actually, each year. So 485,000 deaths. In 2020, 74% of the global population, or 5.8 billion people, used a safely managed drinking water service, that is, one located on premises, available when needed, and free from contamination. As you can see, safe and readily available drinking water is important for public health, and whether it's drinking, domestic use, food production, or recreational purposes. Improved water supply and sanitation and better management of water resources can boost countries' economic conditions and can contribute greatly to poverty reduction. The General Assembly in 2010 from the United Nations explicitly recognized the human right to water and sanitation. Everyone has the right to sufficient, continuous, safe, acceptable, physically acceptable, and affordable water for personal use and domestic use. Sustainable Development Goal 6.1 calls for universal and equitable access to safe and affordable drinking water, and a lot of these, actually all of the Sustainable Development Goals I've lectured on in previous segments. So this is not something new. The SDG 6.1 has been there for a while, since 2015 actually. So drinking water from an improved water source on premises available when needed, free from fecal and priority chemical contamination. So 1.2 billion people with basic services, meaning an improved water source located within a round trip of 30 minutes. 282 million limited services, 368 million people taking water from unprotected wells, and then 122 million people collecting untreated surface water from lakes, ponds, rivers, and streams. So there's geographic, socioeconomic, and sociocultural inequalities that persist between rural and urban areas, not only there but also in towns and cities where people live in low-income, informal, illegal settlements and improved sources of drinking water than others. And then there's water and health, Hep A, dysentery, diarrhea, cholera, typhoid, and polio can be transmitted through contamination poor sanitation. So this goes into a lot of the economic and social effects, and then challenges. Historical rates of progress would need to double for the world to achieve universal coverage with basic drinking water services by 2030. So this has somehow slowed down, and this would need to double. We're already in 2023 actually. And then option for water sources can be used through irrigation, and with an increasing reliance on groundwater and alternative sources, including wastewater. So we have to be creative in order to have drinking water for all. There's some guidelines that were created by the WHO, and since 2014, WHO has been testing household water treatments products against health-based performance criteria. So that is the conclusion of this segment. I hope you've learned some things about how drinking water is not necessarily clean. Drinking water is not available to a lot of the world, at least 2 billion people. Thank you for listening.